Hello, my name is Anthony Hernandez. I'm a student nurse at Cedar Crest College. This is a research article that I'm doing for Nursing Research 322. The article we have here today is spirituality and spiritual caring in a nurse's perspective and practice in palliative and acute care environments. Just to do a little clarification, because sometimes it can be a little bit of misconception between spirituality and religion. Religion can be more of considered like a roadmap that defines beliefs and values and has a code of conduct and ethics. Whereas spirituality is more of a journey and it has more of a dynamic relationship with more that's transcendent with a person themselves or with others or with nature. They exhibit a lot more abstract constructs of faith, hope, and love. The problem that this particular research article has is that it exhibits different philosophies within different environments. The two groups also have not been previously studied together. And the philosophies within palliative care, they are more comfort care, end-of-life care, compared to acute care has more of a curative philosophy. The purpose of this study is more just to understand if individual nurses' characteristics impact spiritual caring or perspectives, and more so to identify and compare caring practices and to determine if there's correlations exist, and to identify different barriers to spiritual care. The significance. Why is this significant? That's always an important question. In nursing research, it has the potential to increase the profile of spiritual caring by nurses. It has the ability to add to the conceptual understanding of such an abstract construct of spirituality and spiritual care. Identifying differences can aid in understanding the practice of spirituality and utilizing that concept within the nursing profession. The literature review for this article provides more of a general direction, but more so adds research questions to the study. It helps the study have more like a blueprint or general direction. It helps the study, it wants to find out if the perspectives of spirituality differ. Do RNs practice spirituality different? And if they do, how are they different, or how does that influence care? And what barriers exist? They're all very important questions to understand to overcome the spiritual caring itself. The research design is cross-sectional, which is more of just a snapshot of modern time. It doesn't have any follow-through or any retrospective perspectives. It's what's happening right now. It has two groups. It's non-experimental. It's also descriptive and is a correlational study. The framework is basically based on the current conceptual understanding of spirituality, and it has a few variables though that are collected with a questionnaire and a Likert scale. The variables are the socio-demographic variables, spirituality, which was collected with an SPS, a spiritual perspective scale. Spiritual caring perspectives were also a variable, and they were measured with the spiritual caring perspective scale, and the barriers of spiritual care, which were also collected by the CSPQ. The sample consisted of a total of 92 participants. It was a non-probable sampling. It had no random assignment. There was 42 palliative care nurses and 50 acute care nurses. It was a convenience sample. and it was drawn from 7 different inner metropolitan health services in Sydney, Australia. The inclusive criterion was basically anybody that participated and completed the questionnaire. It's pretty straightforward. And the inclusion criterion was anybody that just did not finish the questionnaire. The study obtained IRB approval and reviewed informed consent. The results page here I know can look a little overwhelming because it's all statistics, but it was analyzed with descriptive and analytical statistics. If we look at the screen here and just try to simplify it, we have the mean here for the SPS, the SCPQ, and the ranges, and the demographic variables. All of these shown here are studies that they found to be significant. They had a P was less than 0.05. So basically what this states is that the P's are palliative and A's are acute. The palliative nurses had a higher mean score on the SPS, the spiritual caring perspective questionnaire. They had a higher range on the score of this test. They were older, they've been an RN longer, in their specialty longer, and they were employed by their facility longer. Those are basically the important findings of this study. And the biggest variables that they found were that were inhibited their ability to perform spiritual care or assessments were insufficient time, insufficient education, and patient privacy were the biggest barriers. Some limitations to this study were possibly maybe access to some of the facilities. They had to obtain approval to go into the facilities and basically quarantine people to participate in the study. And maybe the sampling method. The convenience sample makes it so that it can't be generalized to the larger population. It's susceptible to bias, and all of those can inhibit the results of the study. In conclusions. So what do we get from all of this? That's essentially what it says. Palliative care, RN spiritual perspectives, and spiritual caring practices were higher than acute caring nurses. Palliative nurses were also older, more experienced, and they're in their specialty longer. It's also found that their environments influence the fact that they have more time to give spiritual care compared to acute care nurses. And identifying barriers is also paramount, and the ability to retain on to experienced palliative care nurses is also very important. It's also important to document and articulate your conversations and spiritual care with patients and your colleagues. And this study has created foundations for more research questions and possibly to generate more hypotheses for future researches. So how is this all relevant to clinical practice? Basically the main outcome of this study was to increase the overall profile of spiritual caring. That was done through the recognition of spiritual perspectives, spiritual caring, and the identification of barriers. The researcher recommends that institutions or people themselves become more self-aware or implement educational programs in the institutions to make people aware of their spiritual care. And raising awareness and education can enhance the concept of holistic nursing, allowing for a greater understanding and appreciation for the concept itself. By increasing our understanding, it can allow us to extrapolate some of the findings, maybe in future studies, that can enhance a greater range of spiritual perspectives amongst different environments or different specialties for RNs, allowing to increase the concept of holistic nursing. So if you have any questions or comments, I hope you've learned something. I learned a lot. Please feel free to drop a question or a comment, and I will answer it however to the best of my abilities. Thanks for watching.